this week's 50th anniversary video series. Today we are going to visit the lab. Come with us.
Hi, Natasha. How is everything?
It's going good.
So we would love to know a little bit more about what happens here in the lab. Can you give us an overview?
Yeah. So our lab has different departments in it. We have core lab, we have micro, we have a reference lab, cytology, histology, pathology, blood bank. Yeah, here basically any kind of specimens come down, whether it's stuff from surgery, blood specimens, urine specimens, stool specimens, anything has to be cultured, anything that pathology has to get that comes from surgery, all that comes down here to be processed for every patient.
And how long has your department been a part of the hospital?
As long as the hospital's been here.
Makes sense.
So we used to have a med tech school way back in the day that used to be connected with the hospital.
Okay.
And people would go through medical technology school, and then a lot of them started working here.
Wow. So can you tell us about how many employees there are that work down here?
There's over
Too many
100.
to know?
Yeah, too many to know.
Okay.
And then what about a fun fact about your department?
I guess one of the fun facts about it is I would say the lab is the one area in the hospital that touches any patient that walks through the door in some form or fashion.
Awesome. Let's go meet your team.
Yeah.
All right. So I am here with Mark. Can you tell me a little bit about what you do back here?
Yes, I supervise our reference services. Our reference services consist of our send-out testing. These are usually esoteric testing that we don't perform in-house. We have a large testing menu that we perform in-house, but there are thousands of more tests that we do send out. And
What are a few of those tests that we send out?
Some of the tests, like our quantiferin golds, which are FB testing, therefore send out for our employee health testing that we do. And so that's one of the testing. We get specimens from all 9 locations, all hospitals within the Tennessee system. So we get drug testing for umbilical cords.
Oh,
so
interesting.
And those go out to our reference lab that's in California.
Very cool.
And so we're doing a lot of shipping. We're kind of like a mini FedEx, UPS
But in between,
sometimes.
okay.
But yeah, we send out a lot of tests that aren't performed locally. And
Awesome.
Try to give a decent turnaround time with that. So.
Perfect. And then how long have you been with the hospital?
I've been here at St. Thomas West for 4 years. I've been with Ascension for 35.
Very cool. Well, thank you for your service.
Thank you.
All right.
We're here in the blood bank with Brian, who is a little bit nervous here, so we're going to be really nice to him.
Oh boy.
In the blood bank, what do we do in the blood bank?
We provide blood products for all the patients here at St. Thomas West.
Okay, is that what's behind me? A giant refrigerator for blood?
Yes, ma'am.
Okay, and where do we get our blood
We
from?
get our blood from American Red Cross. And
Okay.
it can come from this area, but they import blood from all over the country
Okay,
to supply our needs.
okay. And how long have you worked here in the blood bank?
In this blood bank, about 1.5 years or so.
Okay,
Midtown for about 4 years.
okay. And what's your favorite part about working in the blood bank?
Helping people.
Yeah.
Yeah, providing blood for people that need it.
Okay. And how many staff members work in the blood bank?
There's 7 on day shift, and then we have the core lab that rotate in. Probably another 7 more people after that. So,
Well, thank you for answering our questions,
okay,
Brian.
thank you.
All right, y'all. We're here with Lisa, a microbiology technician. What does a microbiology technician do?
Well, it's almost a full circle. So
Okay.
we receive specimens from
Okay.
patients, and then we delegate how they're processed. And so we usually set them up on plates, and that's blood agar, different plates that will grow the bacteria. We also have sections where we do flu, RSV, PCRs.
Okay.
We do a lot of genetic testing. So
That's pretty cool.
Yeah. So it's not just setting up on plates and letting it grow and doing antibiotic susceptibilities. There's a little bit more to it. It's a big process, but it's fun.
That's awesome. How long have you been with St. Thomas?
Now I've only been with St. Thomas 7 months.
Okay, that's lovely.
But I worked in another hospital longer, but I love it here. It's great. A lot of opportunity, a lot of friendly people. I really like working here.
That's great to hear. All right, Lisa. Tell us your favorite specimen or fluid to test.
Well, when we get a positive blood culture, I love to put it on the biofire because it's able to ID the bacteria before it even grows on the plate by
Whoa.
genetics. Yeah, yeah.
Whoa.
So it's really
It's a
interesting.
fire plate, you said?
It's called biofire.
Biofire.
And it's a panel, and
Okay.
it's able to take the genes, the genetic makeup of that bacteria that's causing the problem, and it will ID it before it even grows on the plate. Yes, it's
Wild.
great. That's my favorite.
That's really cool.
And then it helps
Awesome.
patients quicker. You know, they're able to get their antibiotics if they need sooner.
That's wild. That's really cool.
Yeah.
Woof. The more you learn, the less you know.
Yeah.
Thank you for your time,
Thank
Lisa.
you.
Appreciate
Thank
you. All right, we're with Nicole in cytology. What in the world is cytology?
So we screen for cancer mainly.
Wow.
We do every body site. We do what's called fine needle aspiration. The pathologist signs out stuff that we pre-screen, but we kind of help them make their job a little bit easier because we kind of dig through all the dirt. But basically, we assist on fine needle aspiration and endoscopy, CT, and then also ultrasound on occasion. We do every body site. We can do infection. We can see kind of critters sometimes.
Critters.
Yeah. And then, but mainly, like fungus, you get fungal infections in your lungs. Micro is another part that does that too, but sometimes we can actually see them with special stains. So, but yeah, we do every body site really, fluids, but we don't do any kind of tissue pathology, which is another part of our department. They look at tissue samples. So like your core biopsies or your stuff that comes down from surgery, they do that part of it. And the pathologist goes upstairs and they'll do frozen sections for the surgeons and let them know if they have clear margins. So it's kind of real-time information. So,
That's pretty cool.
Yeah.
Roughly how long have you been with St. Thomas?
So I've been on and off since 2002.
Okay.
I was at Midtown originally, and then here I've been back for 2 years.
Because
Or
West,
actually, I guess a year and a half.
and that's because West is best, right?
Right.
That's right.
It is. Yeah.
Is there anything that you want the hospital to know about your section of the lab?
I think we're probably one of the least known parts of the lab because we're a little bit different than the core lab because the core lab touches a lot of different samples, whereas we're a little bit more specialized in what we do. But yeah, we get stuff from everywhere in the hospital. So,
That's pretty neat.
Yep.
Pretty neat. Thank you for your time.
Sure.
Appreciate it.
I am here with Roxanne. She is a point of care coordinator. Can you tell me a little bit about what you do?
Yeah, what I do is I oversee the testing that is done at the bedside mostly, or in the certain specialty areas of the hospital.
Okay. And then how long have you been a part of the hospital?
Of this place here, I've been here for 3 years.
Okay. And then what is your favorite part about working here with us?
I just love the people. This has been a really good experience. This is good.
Can you explain a little bit more about what kind of tests we do with point of care?
Yes, well, we have glucometers in which we run whole blood glucoses at the bedside, and then we have analyzers, our iStats, and we do blood gases and chemistry tests, and we do PT-INRs on patients and creatinines. And we have recently brought on our tags, which are analyzers that we're going to be using here in the lab and at the up in the OR suites, which will help us use blood products more efficiently.
Awesome. Well, thank you for your time.
Thank you.
Tasha, tell us a fun fact, an overall fun fact about the lab.
The overall fun fact about the lab at West. So the lab at West is kind of a hub for all of the Ascension hospitals in Tennessee.
Pretty cool.
We get all the micro specimens from all the hospitals come here. There's a lot of chemistry type tests and other tests that they don't do at other facilities that come here. All the hepatitis testing, HIV testing, COVID IgG testing, some thyroid type testing, all that they don't do at other sites all come here to this hub here. So we're kind of like a little reference lab for the whole Ascension, Tennessee, basically.
So just another reason why West is best.
Exactly.
Appreciate it. Thank you.
thank you all for watching our latest edition of 50th anniversary video with the lab. I hope you had as much fun watching it as we had making it. Have a wonderful rest of your day. Bye.